Before I move on, I want to introduce our guest of honor for this evening, which is going to embody her encore. I want to introduce Miss Kamaria Laffrey. So I do want to give you some information about Miss Laffrey, just so you know how outstanding she is. So Ms. Kamaria Laffrey recently featured in Women's Health Magazine online. That was in January 2021, so that was this year. Kamaria Laffrey is living with HIV, chronic optimism, and Black Girl Magic. Serving nationally as a speaker, an advocate for HIV justice, a spokesperson for treatment and adherence and self-care, and works with the SERO Project as a Southern Community Engagement Coordinator to mobilize communities in changing those legislative policies that unjustly prosecute people living with HIV. So that's very important. Her local work extends to rural and underserved areas, as she serves on the West Central Florida Ryan White Care Council and the Florida Department of Health Community HIV Advisory Group since her diagnosis in 2003. Kamaria has worked to empower others to live beyond the historical residue and self-induced stigma of HIV. In 2018, she's a 2018 graduate of Positive Women's Network, USA's Policy Fellowship Program. Kamaria is looking forward to furthering her patient advocacy in gender and racial equity justice for people living with HIV. Sharing her lived experiences in Pause Magazine, Plus Magazine, and various health blogs, Kamaria seeks to be a willing vessel of faith that guides individuals in her community towards embracing healing, giving inspiration, and living victoriously with HIV through her developing community-based organization, Empowered. That's the title of it, Empowered Legacies. By being available for public speaking, one-on-one peer counseling, workshop development, social media outreach, and program consulting, Kamaria emphasizes empowerment, sexual responsibility, and the development of spiritual principles for individuals all over the world. So without further ado, I want to welcome Ms. Kamaria Laffrey, and you guys, please tune in and enjoy her. This is gonna be great. Go ahead, Ms. Laffrey.
Thank you. Thank you so much, Chelsey. It's funny when you're writing a bio, you don't realize how long it is until someone's reading it. You're like, good Lord, that's a lot of information.
It's worth hearing, I promise.
Thank you. Thank you so much. Where to start? First, I want to acknowledge Kai. That poem that she read really resonated with me. There was a line, and I'm probably not going to quote it right, so my apologies, where she was talking about how she refuses to be bound to data or acronyms in a book. And that hit me, because I remember when I was diagnosed, I didn't know what advocacy looked like. I didn't know what I was going to do with it, or what it was going to look like in my life, but I know what I didn't want. That's one thing about me. I always know what I don't want. And I did not want to be another statistic. I was a newly diagnosed and was a brand new mom. So I was a single mom. And I was like, Lord, I'm hitting all the marks of being that typical statistic of, how society paints Black women. And I was just like, I'm not going to add any more to this. So I've built, as much community around me to keep me from falling into the cracks of a statistic that sometimes you read statistics and it paints a picture of people who don't matter, that you should feel sorry for. And I didn't want to be in that group. And I wanted to fight to help other women not be in that group. So my passion and my drive comes from not wanting to see the women around me or people around me end up in the same spaces that I had been in. My diagnosis, I didn't go the route of like traditional testing, right? Like having a scare or a concern and contacting a clinic or going to an event and saying, hey, I think I might want to get tested. What actually happened was I got pregnant and tried to hide it for a really long time. I went like 5 or 6 months. I was showing, but I hid it as much as I could. And I ended up, registering at my local women's clinic to give birth. And I had no prenatal care. By the time I registered at the local health department, I'm in Florida. By the time I registered there, they were so backlogged that my wellness check would have been after my due date. So I couldn't get prenatal care because I waited too long. So I was given an estimate due date of July 17th, 2003. That day came and went. July 18th came and went. And I'm like looking crazy because I'm in pain and I'm tired of being pregnant. And finally, the doctor, out of concern because I hadn't had prenatal care, the doctor that was there that day decided to go ahead and induce my labor. So they induced me and I gave birth, and I have this little person, and I'm freaking out because now I'm a mom. And they told me that, they had to run all these different tests because I had no prenatal care. And I had a natural birth, no epidural, no drugs, just lots of pain. And when I'm in a lot of pain, I go to sleep. So I slept through the opportunities for her to like have the skin to skin contact. Like they would layer on me, but I would be knocked out. And I remember like maybe a day and a half later, them bringing my baby into the room and like with a lactation counselor and wanting me to try to practice breastfeeding, which I thought, in hindsight, I thought it was weird that they did that when they didn't know my status because I had no prenatal care. I also didn't know my status, and I was excited to be a mom now. So I tried to, breastfeed her. But because they had been giving her bottles, she was already like with the bottle. She was like, I don't want the nipple. I don't want any parts of that. So they were advising me to pump into a bottle. But when I would pump, she would spit it up. So hindsight, again, I took that as a blessing. Now that I look back, I'm like, thank God that she didn't, because I was living with HIV and I didn't find that out until 2 weeks after I gave birth to her. They called me and told me to come in and see the doctor who delivered my baby. So they sat me down, walked me through all the things, tried to connect me to the health department to get into care. But the doctor that was diagnosing me had never diagnosed someone living with HIV before, and she didn't know the resources that were in my county. So I was kind of like falling in the cracks from day one. Some time went by, and I'm just trying to wrap my head around what does this life look like now. And I had to have my daughter tested for a year because she had my antibodies. So she tested positive, but there was an opportunity for her to take treatment and allow her own immune system to build up, which eventually happened a year later. They told me that she was HIV negative. She is 17 now and will be graduating high school this year. And I don't think my gray hairs are showing, so we're all good. But she is everything to me. She is why I'm doing this. When that year it took me to find out whether or not she seroconverted was probably one of the darkest years of my life. Depression, suicidal thoughts. But in those thoughts, I was being proactive and I was trying to write down like every possible secret I could about myself that I wanted her to know in case I wasn't around to tell her. And I started writing a book. Haven't finished it yet because life goes on and there's stuff I want to share with her and tell her. But she's why I do what I do, because I didn't want I don't believe in like living in secrets. I've seen what secrets can do. I kept my diagnosis a secret from my family for like a year. I talked to my dad last night, and even 17 years later, he still has scars from that because he was like, I was kept out of the loop. You're my baby and you're sick and you didn't tell me. He understands why, but seeing what the secrets did just in that small window of time, and everybody understood why I kept it a secret, but it still caused pain. It still caused damage. And I have vowed to help people who don't have the support system that I have, or don't have the desire even to step outside of the shadows of stigma, because that's what it was that whole year. It was just this huge cloud of stigma over me, of being afraid that people will reject me, of being afraid of people looking at me differently, of being a disappointment, of disgracing my family, and just all these different labels of negativity. And the more support I got, the more love my family showed me, even though they had no idea, they didn't know anything about HIV. The more I started leaning on that and leaning into there's life beyond this. Like, I'm not going to be a statistic. I'm not going to be those letters in a data book that someone's studying. I'm going to live past this. We're coming up on almost 40 years of HIV and AIDS being an epidemic, and I'm 38. I'll be 39 this year. And I think about that every time World AIDS Day comes. I'm like, what could have been done in my timeline, in my life, that could have prevented me from living with this if we're 40 years into it? So I always think about that, and I always try to use that as a motivation as well to help drive the needle forward in the conversations such as this when we're talking about, testing and prevention. Things like PrEP weren't around, when I was diagnosed. Um, Being able to take a pill to prevent you from getting HIV, if someone had offered me that with education and some empowerment, then I probably wouldn't be sitting here with HIV right now. If concepts around undetectable equals untransmittable, U equals U, was talked about more from providers, from physicians, I probably wouldn't have lived in as much shame and fear as I did for many years after I had my daughter. I, talked to my friends about having another child. My daughter was a blessing, where she didn't get exposed to HIV. I had no prenatal care, so that means I wasn't on any treatment to prevent from transmitting the virus. I tried to breastfeed her and still didn't transmit the virus to her. I consider that like a blessing. Like, you can look at it scientifically, but it's a blessing that it didn't happen to her. But then I look at, like, what if I wanted another child? And for many years, I thought that I would have to jump through hoops to be able to conceive, to be able to give birth, to carry and to give birth. I married in 2012. My husband was also HIV positive. And we talked about all the different things. And we talked to our doctor about our desires and what we wanted and what were our options. Never once did his provider talk about undetectable equals untransmittable, that if we took our treatment and had built up a suppression of the virus in our body for 6 months or longer, that we couldn't retransmit the virus to one another sexually or transmit sexually to other people. They weren't educating us on this. And finally, I switched to a different doctor. And the first question she asked when she met my husband, she's like, when are you going to have babies? And I looked at her like I had given up on that dream. I was like, I don't know. If God thinks it's funny and I get pregnant, okay, cool. If not, then it just wasn't meant for us. And she was disappointed in my like kind of dismissive response. And she kept, every time I went, she got on my nerves. She kept talking about, when are you going to have babies? Just to fast forward through that, my husband and I never did conceive. He actually passed away in 2019. So I kind of consider that a blessing, I guess, even though it would be nice to have something that reminds me of him besides pictures. But I'm grateful that we at least knew that we had hope and we had options through this newer provider that we did have. And I being a parent, I think about my daughter's 17 and I try to be the cool mom and, let her come to me and talk to me about things like dating. She don't tell me nothing, nothing. So, but I try to educate her and I talk very openly about all the things and just hope that it's landing, that she hears it. One thing I try not to do is make decisions for her about her body. Like, for example, my grandmother, old school, her education for sexual education was don't bring home no babies. That was it. That was literally it. And a couple of scriptures that I don't quite remember at the moment. So I was like, I gotta do better. We're going into 3 generations of women, and there's been a consistent pattern of someone in the family, having a child early or something happening that makes them a quote unquote statistic. So I try to talk to my daughter about, birth control and condoms, and beyond that, just loving herself and having autonomy over her body and being able to like say no, and teaching her what consent really looks like, and that you can change your mind in the middle of an act, and that is no longer you giving consent. I try to empower her that way. She's a feisty young thing, so I don't have any fear about her speaking her mind and letting someone know when they've gone too far, because she lets me know. She uses the word boundaries quite often. So sometimes I regret teaching her to be so outspoken because she gets on my nerves, but I love her so much. I really do. She's a light in my life. And again, like I've said before, she is why I do this advocacy work. I want her to see that you don't have to let a diagnosis erase any hopes or dreams that you have. I've talked to many women who are like, oh, well, I can't do this now, or no one's going to want me now. And I try to talk to them and let them know that you are way beyond, you can live beyond your fears. You don't have to let fear or shame or other people's expectations on you hold you back. One thing I like to teach folks or guide folks through when they're newly diagnosed is allow yourself to feel whatever you feel. We're human. There is no one way you're supposed to act when you receive a health diagnosis. Anything that alters your life, you have the right to feel afraid, angry, scared, frustrated, confused. Like all those are normal reactions. It's what you do with those feelings. It's how long you live in those feelings. It's when you let those feelings dictate how you make decisions in the future that kind of can have a negative toll on you. And one thing that a therapist helped me do was to always tell myself that I am more than enough, not just I'm enough, because I'm enough can be someone else's checklist, not mine, but I'm more than enough. So even if you think I'm enough, I'm more than that. Knowing my worth and adding interest is what I like to tell people to do. Like, know your value, and then always, have people come correct when they try you. That's a whole nother conversation for another day. There's something in advocacy I like to talk about a lot, and I found myself listening very closely to Dr. Elliott's EHE presentation. I appreciated her saying that she did not create those slides from the website, because sometimes in advocacy as a person living with HIV, one of the things that folks, I guess, over time maybe haven't paid attention to as much, but the words we use to describe ourselves, how we speak about ourselves, adds to that stigma, or it can eliminate the stigma. And one term, I don't know why it's been bothering me all day today, maybe because I've been on a lot of Awareness Day Zooms, but the word infected drives me to like want to flip a table over. I am not an infection. I'm a human being that's living with a virus. I was a human being before I was diagnosed. I am not an infection. I am more than that. So whenever I see that word, especially by our larger entities, no shade, just calling it out for what it is. Whenever I see that language from those folks that are putting out data and putting out resources that impact my life, I have to call it out, because I'm like, I'm not this word that you describe me as. And there's a whole chart of how you can switch terms that you use. I remember for years, I carried this horrible feeling of being a mom that gave birth to a daughter living with HIV, because of the way it used to be articulated was mother to child transmission, which puts all the pressure on the mom. Like it's all your fault because it's mother to child transmission, instead of I'm a mother that has HIV that could have caused vertical transmission. And that when I learned vertical transmission, I literally cried when I sat for the presentation, because I was like, this, just that simple shifting of words took this weight off my shoulders, where as moms, as parents, we carry guilt from day one. Just if they sneeze wrong, we feel bad. If somebody looks at them wrong, we feel bad. So like having medical terms describe you and having your providers who are supposed to be guiding you towards a healthy living, utilizing these terms, really keeps you like from wanting to go to the doctor. I still struggle to this day of like actually wanting to go to the doctor. Like it's a struggle to make it, to call every 3 months and make that appointment or do the check in for my eligibility. It's exhausting. While we've come a long way with HIV to where some people are only taking one pill once a day, such as myself, we still have a long way to go when it comes to provider-patient relationships. That should be an equal line relationship. It shouldn't be a hierarchy. It should be, communication from one person to another, a team trying to come up with the best plan for healthy living, and so that I feel comfortable communicating with you. I've experienced some very stigmatizing doctor's appointments where I've met new doctors and I've intentionally not told them I was an advocate. I've intentionally not said what I did for a living, because the times I've noticed like whoever's sitting there will brush through the questions that they're supposed to ask me. They just skip over stuff. They don't talk to me about my labs. They kind of bypass information because they assume I already know. Yeah, I know to help advocate for my peers, but today, right now, for just 10 minutes I'm sitting here, I'm a patient. And maybe right now I'm not feeling the best. And maybe I need a refresher and I need you to talk to me. And give me the opportunity to tell you, like, I need a refresher. I need to understand my labs a little bit more, or I have questions I need you to kind of go over, not just assume, oh, you're an advocate, you already know. And I say this because like literally my face has been on a flyer inside of a triage room. And I'm like, can y'all please take that down, because people will see it and then think that I don't need education, or that I'm there purposely to educate you. And I'm like, I didn't go to medical school. That's not my job. So it's a blessing and a curse. It's like a double-edged sword of being able to kind of have this power to be able to, speak to providers and have this knowledge when you're in these appointments. And it's also a weight that you carry, because sometimes I just want to be me. I just want to be Camaria. I don't always want to be the advocate. When I'm in those spaces, which I'm really grateful for, virtual spaces like this and in-person spaces, especially with Alabama. Alabama's like my second home. I was gonna move there like right before I met my husband. And I met him, he was like, Alabama? No, we're staying in Florida. So unfortunately, I'm still here. But I love whenever I'm invited to share my truth, my lived experience, um, and be able to speak, on a platform where folks can hear me and value me. I'm really hitting a level in my advocacy where I'm noticing people who've been doing this for longer than I have. I've only been an actual advocate since an HIV advocate since 2009. I will quote my dear friend Stacey Jennings, who says that you've been an advocate since birth. From the moment you're crying, you're an advocate. So I always appreciate, her perspective on what advocacy is. But HIV advocacy has only been a part of like my life since 2009 specifically. And I value the people who've come before me, but I also recognize that there's a lot of spaces where decisions are being made and the voices of the people that are being impacted are not taken seriously, which is why I do the work in HIV policy, where laws that have been outdated since the 80s, there's laws that are on the books from 1984 that criminalize people based on their health diagnosis, that don't look at whether there is an intent to transmit or if actual transmission occurs, or protection or a viral load. They don't look at any of that. It literally is someone can say she or he didn't tell me they were HIV positive. That's it. The prosecutors don't look at whether there was actual exposure or whether there was transmission or proof of disclosure. And once I found that out, and it's different in a lot of different states, the South, of course, is the most problematic, but I got involved in that work because of advocates that have been doing this work before me. And I'm just like, I get it. Like in the 80s, we were terrified. And this feels very familiar, probably how I'm going to describe it. People were dying and we didn't know how to make it stop. And legislators wanted to try to fix it. And we needed funding to do research to fix it. And in order to get the funding, you had to legislate something. And that ended up being people living with HIV. And down the line, people stopped dying. So people didn't pay attention to the fact that the laws were still in the books until we started paying attention to mass incarceration and that people are in prison for something that didn't really have or create harm for someone else. There's people sitting in prison right now that didn't transmit HIV to anyone else. And the more advocates started looking at this, I want to say 2011 is when the SERO Project started with Sean Strube and Robert Suttle, and they wanted to make a change. So I got involved, and it's no easy task whatsoever trying to change a law, but it's something I will not give up on. And I'm so grateful to work with other advocates in other states like Virginia, Iowa, California, Colorado, Michigan, Georgia's killing it. Trying to change, these laws and either completely get rid of them or at least modernize them to where the proof of the weight of prosecution is heavier. So people aren't being sentenced 30 plus years in prison for HIV, potential HIV exposure. And I actually did not mean to go on that tangent, but it's a part of what I do every day. So I can't help but talk about it. And I also don't remember how much time I have to speak or if I have space for questions and answers. I did catch in the Facebook Live on my phone that I have a few colleagues that are watching. I saw Lisa Johnson-Lett, so shout out to Lisa, love you much. So I don't know if I have questions or anything like that, if anybody wants to ask me anything, or if I'm out of time, then I'll just stop talking.
All right, Steve, do we have any questions on your end, or are we good to go?
So everybody, thought I would interject one more little quick fact here. Before I do, and certainly, gosh, Ms. Camaria, you spoke to our hearts, you spoke to our heads. I don't know if you're able to see the comment crawl on Facebook, but you are now one of my sheroes. So,
oh wow.
I also want to,
I think it's important also that we understand that events like this don't just happen. It takes great leadership, and certainly we have that in Chelsey, we have that in Dr. E and of our other panelists, but also joining us this evening, I hope they're still there, are two of our directors from the ADPH Office of HIV Prevention and Care, Ms. Sharon Jordan and Ms. Jora White, and they have been tireless advocates for HIV in Alabama from a programmatic point of view, the constant need to find funding, and they are fantastic grant writers. So we're so pleased to have them with us this evening, and we know that you are as well.
Kamaria, I also just want to say quickly, I thank you so much for saying you took a vow. That means a lot, especially for me. Being that I'm 22 years old, I can say since I've started at OHPC with ADPH, I consider myself a small advocate. So I'm starting my journey. I'm getting to know these facts and educating myself. So to hear you say that is very inspiring, because now I know when you said living past this, you always hear people living with HIV, but you said living past this. So I do appreciate your onward spirit. You're one of the kindest women I've ever met in my life. I know you're a great mother. You remind me of mine. So I'm extremely thankful for you this evening. If there's anything else that you have to say before you do leave, I know you're tired. You've been on Zooms all day. So you can do so. But I want to thank you for this.
No, thank you. And I have to say, there's no such thing as a small advocate. If I call this heart work, not hard work. And if you have a heart for it, if you have, excuse my language, if you have a give a damn, then you're a big advocate, because it takes heart to do this. So thank you for this platform. Thank you for this opportunity. And yes, while I am tired, this is not my last Zoom for the day. I have two more. So this is the world that we live in now that COVID is a real thing that's caused us to pivot and renegotiate our time. But I will be in touch with you. It is so good to be reconnected with you. Thank you for remembering me for the times of coming to Alabama, to the high schools to speak. I think I did see a question in one of the chat boxes about, is this a high school program for juniors and seniors? I'm happy to come whenever we're like allowed to travel again, or if we have a virtual thing. And I know I can probably stay on like Tony's couch or Lisa's couch while I'm there. I'm just kidding. Or yours. But yes, much love to all of you. Thank you for sticking to making this a priority, even in the face of COVID. I know that's not an easy thing to do. And it is appreciated, and it doesn't go unseen or unappreciated. So thank you so much. And Miss Tisha, Dr. E, if I don't see you again in these virtual streets, much love to you, and take care of yourselves.
Bye. Thank you.